Good evening. My name is Theresa Green, and I will be discussing ulcerative colitis, the diagnosis, treatment, and management. This presentation will provide an overview of ulcerative colitis, including its prevalence and impact on the U.S. population, etiology and risk factors, underlying pathophysiology. In addition, this presentation will highlight clinical manifestations and complications, review current treatment options, and explore evidence-based nursing practices essential for improving patient outcomes. Ulcerative colitis is a chronic inflammatory bowel disease that affects the rectum and sigmoid colon, causing inflammation and ulceration in the colon lining. While UC is an inflammatory condition, it can lead to malabsorption and nutrient deficiencies due to damage to the colon, potentially resulting in malnutrition. In the U.S., it is estimated that ulcerative colitis affects approximately 600,000 to 900,000 of the population. It is on the rise among people between 15 and 35 years of age. The disease represents a significant economic hardship with the cost of hospitalization, medications, and ongoing medical treatment reaching approximately $8 million annually. Besides the fiscal implications, UC can profoundly affect the individual's quality of life, contributing to frequent loss of work and school absenteeism and increased psychological stress from managing a chronic and relapsing illness. The exact etiology of UC is unknown. However, research has proposed that it may involve a combination of environmental factors, genetic influences, and immune dysregulation. Having a first-degree family member with ulcerative colitis greatly increases the chance of developing the disorder. Environmental factors like diet, exposure to certain infections, stress may influence disease onset and progression. In addition, smoking cessation has been linked to an increased risk of UC. Ulcerative colitis involves chronic inflammation of the colon's mucosa lining, beginning in the rectum and spreading upward. Damage to intestinal epithelial lining allows harmful substances to penetrate, which activates abnormal immune responses. This leads to excessive production of inflammatory cytokines. Gradually, persistent inflammation causes ulceration, bleeding, and malabsorption of nutrients. These changes explain the main symptoms of ulcerative colitis, including bloody diarrhea, abdominal pain, and urgency. Patients with ulcerative colitis typically present with watery stool, often mixed with blood and or mucus, along with abdominal cramping and rectal urgency. Also, fatigue and weight loss are common because of chronic inflammation and nutrient deficiency. Complications may include hemorrhage, toxic megacolon, and increased risk of colorectal cancer with long-standing disease. Extrinsic manifestations like arthritis, skin lesions, uveitis can further diminish well-being and complicate disease management. The treatment goal for ulcerative colitis is aimed at promoting and maintaining remission. First-line therapies often include medications such as aminocyclisates, which reduce mucosal inflammation. Corticosteroids are used for acute exacerbations. However, due to their side effects, long-term use is not recommended. Immunomodulators and biologics such as anti-TNF agents and JAK inhibitors provide moderate to severe disease options. In refractory cases, surgical interventions such as colectomy may be necessary. Treatment options are individualized based on disease severity, involvement, and patient response. To care for patients with ulcerative colitis, Emphasize symptom management and patient education, emotional support. Evidence-based practices include monitoring stool frequency, assessing hydration status, and implementing dietary modifications to reduce symptoms. Nurses play a critical role in medication management, ensuring adherence to prescribed therapies and monitoring for side effects. Equally important is providing education on stress reduction techniques. Assessing hydration.